So, I'm not going to take too much of our time initially, except then to again extend a warm welcome to our series of dialogues. I'm going to ask Godwin to just give us a heads up again on what we intended to undertake and where we are as we speak. All I want to encourage us, both online and in the room, as we commence this conversation today, examining our progress on teacher and learner wellness, or teaching and learning wellness. As we do so, just to ask ourselves the question, in the first instance, how well are we doing in this space, given its importance and significance? So obviously the first question is, why does it matter? The second is, given that it matters, where are we? In particular, which are the areas we're doing really well in? And second question would be, so which are the areas that need some improvement? And which are the areas that need a fundamental reset? So a reflection on where we come from, a reflection on where we are, a reflection on the future. All of it intended for us to be able, in, I say tongue-in-cheek, in a 500-word abstract, to say to the minister and to say to the incoming administration, here is our assessment. Here are the implications from what we see in the future. Here is where we need to scale up and consolidate. Here is where we need to make a fundamental reset. So if we could keep that in mind as we continue with this conversation, and as I now invite Godwin, Dr. Kosa, to speak to us on item 2 of the agenda, to share with us an overview of this current dialogue series. So, Godwin, over to you, sir.
Thank you, Chair, and good morning to colleagues in the room and on the virtual platform. I suppose the point I think to take this from is to remind ourselves about the NECT's Education Dialogue South Africa Forum, which we started with in fact, it's the basis on which the NECT was founded, because the founders of the NECT came together to talk about how to implement the Chapter 9 of the NDP, and ultimately adopted a program that has a specific provision for conversations, dialogue. And I think that message is important to refer to. We have some evidence that these conversations that we've had from 2012 have actually contributed in a significant way to getting various players in the education improvement space to converse about where education is and where education is going, and where each one of us could actually take position and contribute to the ongoing reforms and education improvement in the sector. So during the course of 2023, in the programming of the Education Dialogue SA, a decision was made to find experts and practitioners who work in about 14 areas and request them to undertake some reflections on where we are as the education sector and as the education system of this country since the dawn of democracy, so 30 years, back. And we identified a particular themes which we thought that the players in the education space will be interested or are critical for that matter to reflect on. And these include, amongst others, a reflection on the education manifestos from the very first manifesto that we had in 1994, and their developments, throughout the various election cycles and administrative, cycles. Some interesting insights and observations were pulled out, presented, to the first of these policy dialogues that we, started in 2023, and that was in November. There is a paper that is being written on governance, whose conversation would follow. There are papers that are being prepared and dialogues that are being scheduled on leadership and governance in South Africa. There are papers on curriculum, extra curriculum, pedagogy, learning materials and assessment. There's a fifth paper on the professionalization of teaching. There's a paper on a strengthening the capacity of the system with specific focus on districts, and we've had a dialogue in the past, couple of weeks, on that. We are working on a paper that reflects on infrastructure, strategy, funding and expenditure in education, evaluation, monitoring and accountability, and essentially as looking at them as instruments, that have to be used amongst others to drive education improvement going forward. We also are looking at, in fact, there's a paper that's being finalized on technology in education, foundations for learning, and the last one, which we're looking at today, focuses on learner and teacher, wellness. So we do actually just, organize dialogues on these papers as and when they get, ready. It is envisaged that these papers will be completed by the middle of the year, and we would have conversed on each of these, if not all of them, some of these, if not all of them. But ultimately, in the second half of this year, we should be in a position to pull these papers together into a book, a publication that will be available to education researchers and practitioners in the sector. So we're very excited today to be looking at one of those papers, specifically interrogating issues of learner and teacher well-being, which the chair has already started elaborating to. Often not considered as the mainstream or one of the mainstream cogs in the improvement of education. And part of which myth actually, I think, was expunged during 2020 and 2021 at the height of COVID. With all these complexities, social complexities, economic complexities, environmental complexities that are emerging going forward, even the complexities that are emerging, for instance, in technological development, advancements, learner and teacher well-being will become more and more important, to consider and to, as part of the development of strategies for education improvement. So, Chair, those are about the themes and the dialogues that we will be embarking on going forward, and how we will try and pull all this together with a view to contribute to the policy analysis, ongoing policy analysis on education. Thank you.
So, colleagues, there we have it. I think if I have it right, Godwin, we're now into number 4 in the series. Today we have a really exciting team of contributors. We were expected to be joined by Dr. Lamboli Kumbaneki from the SADC Secretariat to make opening remarks. Unfortunately, he is not able to join us this morning. We will instead be joined by Dr. Gushimana Monjolo, who is the CSTL Program Officer at SADC. We'll also be joined to present the framing paper for us by Mr. Liko Bottoman, our colleague and director in the Department of Education. He has been working with a number of colleagues on this framing paper, and he will introduce the colleagues and invite them also at the end of his presentation, at the end of the presentation, to offer some highlights or some specific interventions they wish to make. We will then have our colleagues, Professor Volmink and Professor Pillay, as respondents. So a very interesting conversation we will be having this morning. Colleagues, can we ask if we all could just mute online? That would be greatly appreciated. I now see we are down to one person online, am I right? Okay, mine is not updated, apologies. A really exciting conversation, a very important conversation that we're having this morning. Yes?
Could we mute everyone except the chair, please?
All right. Thanks very much, colleagues. So allow me, first of all, just to remind us that as the conversation continues, we would really appreciate your assessment of the work. So please keep that in mind. We will post that.
You're muted, Chair.
Oh, gosh. Okay. Hello? Hello? Can you hear me now?
Yes, now we can.
Oh, my sincere apologies. My sincere apologies. I was saying that we have a really exciting panel of contributors this morning, beginning with Dr. Gushimana Monjolo, who stands in for Dr. Lamboli Kumbaneki. We have Liko Bottoman, our colleague from the Department of Education, heading up CSTL. He will be joined by his co-authors, and they are Lynn van der Elst and Andile Dube. If I miss anyone, Liko will indicate so. So they will then be followed by our respondents, Prof. John Volmink and Prof. Jace Pillay. And then we will open it up for conversation. So my appeal, colleagues, firstly, is if we could complete the register online. The link has been posted in the chat box. And then secondly, please just be on the lookout also for the evaluation form. We all the time are looking to improve, to gain new insights from you on how we can do things even better. So very important for us to get your perspective and your assessment. And then finally, please make use, as you have just done now, reminding the chair to please unmute. If we could use the same chat box also to post your reflections. Recall the idea being, what are we doing? By the way, why does this matter? Secondly, given that it matters, how well are we doing? Which are the areas that really stand out and that we need to scale up in, that we need to consolidate? Which are the areas that you feel need some real work, some additional work? And which are the areas where we need to do I wouldn't say a 90 degrees turn or a 180 degrees turn, but which are the areas that you feel we need to to, to, to shift fairly significantly in. So as you reflect then and as you reflect on the contributions this morning, we'd be most grateful if you could post your insights and your reflections. So on that note, I think we are ready now to invite Dr. Gushimana Monjola to join us online with a set of introductory remarks. Please, Doctor, if you don't mind unmuting and joining us. Welcome.
Thank you, sir. Thank you, sir. Can you hear me?
Yes, in the room we can. Thumbs up online.
Yeah, I can. You can see me also?
Yes.
Okay, good. Thank you so much. Good morning, everyone. Thank you so much for this opportunity that you give me for the remarks, opening remarks. Excellencies, distinguished delegated, ladies and gentlemen, it is a great pleasure for the SADC Secretariat and me to welcome you to these dialogues centered around teachers and learners' well-being or education improvement. I'm very glad to acknowledge Education Minister of South Africa and other at-level participants and delegated joiners online also in the room. I would like to warmly welcome representatives from partners and other stakeholders groups who are with us today. You know, poverty and its consequence for children do not operate in isolation. They intersect with a range of other vulnerabilities such as gender inequality, geographical location of majority of the population, poor health, including HIV and AIDS, ethnicity, language, disability, war, and natural disaster, all manifesting as barriers to education. This factor is one combination or another magnify the risk and level of education exclusion, creating especially educationally vulnerable groups of children in the SADC region. Care and support for teaching and learning is the region's response to these vulnerabilities and contributes to the various international, continental, and regional obligations and commitments of SADC member states, and also to United Nations Convention on the Rights of the Child, the African Charter on Rights and Welfare of Child, and other commitments that you know very well. Importantly, care and support for teaching and learning is not a new program, and it is not intended to replace the value and numerous care and support initiatives that exist to support vulnerable learners. Rather, it provides an overarching framework for the coordination and expansion of care and support activities, activities that aim in all instances to improve education outcome. Also important is that the success of CSTL is ultimately determined by increasing numbers of children and youth who are enrolled at the school at the appropriate age, able to attend school regularly and complete their schooling, provided the opportunity and support to enable them to reach their full potential. Ladies and gentlemen, it might be worth providing a summary of the journey of care and support for teaching and learning. As you know, 2006 to 2008, school as centers of care and support, which was the precursor to care and support for teaching and learning, was implemented in South Africa, Eswatini, and Zambia. 2008, based on the positive results of the three countries, the SADC education ministers adopted the model as a regional program, and the name was changed to Care and Support for Teaching and Learning. 2008 to 2016, Care and Support for Teaching and Learning is implemented in 7 member states, with regional sharing across all 16 member states. 2016 SADC policy framework for care and support for teaching and learning adopted by the education ministries, and SADC's guiding policy framework for the mainstreaming of care and support through the regional education system. For those who are not familiar with the care and support for teaching and learning policy framework, allow me to provide a brief overview. Principles underpinning care and support for teaching and learning includes a systems approach, sustainability, the child at the center, a coordinated multi-sectoral approach, right-based, equity focuses, inclusive and non-discriminatory, participatory and empowering. The systematization and mainstreaming of care and support for teaching and learning depends on integration into the design, delivery, funding, and monitoring and evaluation for all education objectives, inputs, outcome, infrastructure, programs, system and management, coordination, and other institutional arrangements at all levels of the education system. To achieve this framework provides 10 policy statements. A 3 core policy statements guiding the delivery of core services. These are related to the availability of education, access, retention and attendance, and quality of education. The other 6 complementary statements that require the education sector to facilitate the delivery of services by no-education partners. These are related to health services, food security and nutrition, safety and protection, psychosocial support, social assistance, and other documents. Importantly, care and support for teaching and learning does not propose a one-size-fits-all model, and so the implementation of CSTL differ in every country and every context. Member states have developed contextualized national frameworks, and South Africa will be discussed as part of the paper presentation. Ladies and gentlemen, let me finally wish you a successful meeting and discussion, and assure you that the SADC Secretariat will spare no effort to help the region and South Africa to deliver a successful session and for the quality of education. Today, I look forward to learning about the progress South Africa has made of the past years in the provision of care and support through the education system, especially for the learners, teacher, and well-being for the improvements, education improvement. Thank you so much for your attention.
Thank you very much, Doctor. Thumbs up, colleagues. I don't know how I mess up this thing online, but I hope you can hear me online. So thank you very much, Dr. Gushimana, for giving us the regional perspective and giving us insights into South Africa's evolution and position in respect of the region. Thank you so much. And we hope you will be able to have time to join us in the remainder of this conversation as well. And you should feel free, obviously, as the conversation unfolds, also to post some comments, and we might also just reach out to you towards the end to share some reflections on what you have heard this morning. So thank you so much. This is greatly appreciated.
Thank you, sir.
Thank you. So colleagues, I think we can now move along and invite Liko to share with us then their paper that will assist us in framing our conversation today and going forward. You okay there, Liko? I think the camera should be able to pick you up, or yeah. Okay, cool. Over to you.
All right. Thank you.
Tell me, are you okay handling that thing as you present?
Yes, that's
Okay.
fine.
Okay.
That's okay. Thank you very much, Chair. Good morning, colleagues. I just wanted to share with you, Chair, just a couple of things. The first thing is that I was bewitched by Mr. Duncan Hindle, who, when Brennan Smith left the DBE, sent me to a SADC engagement on CSTL, and it has never been able to get off my back. I've changed offices 3 times at DBE, and everywhere I've gone, CSTL has followed me somehow. So I can't shake it off. So this is all because of Duncan. And the second thing is that I was fighting with Dr. Godwin Khoza about my hair. And I think, and I'm happy that Mr. Matakane is here, because we are resolved on the hair issue as the basic education sector. So there is no push for me to comb my hair. I can come here with my hair uncombed, and it is fine. I'm just hoping that the slides will be flighted as I am just giving a background. Maybe for those that are joining us for the first time, or those that are new in the whole conversation about CSTL, I think it is important for us to mention that themselves. And so you need to be able to identify some of the inhibitors of well-being for the teachers in order for them to be able to provide the service. And if you look on the outer layer, if you look at the donor funders, for example, it's important for us as a country to no longer accept donor funder objectives as they are, that we're able to adjust and modify them so that they respond to the apparent care and support needs in the basic education sector. We come from a space, Brennan knows, where donors would just come and say, we have to deliver 30 workshops on violence prevention in these schools. They even tell you in which schools. Sometimes the schools that don't even need that kind of intervention. And so it means then that that level of well-being for donors is also very important, that if they're about to help us to mobilize resources to provide care and support in schools, it means then that they also need to go through some level of conversion for them to be able to do this. But also what is very important, particularly with parents and caregivers, foster parents and extended families, you'll see that that layer is highlighted in orange or amber. This is because that layer is always, we haven't come to a space, colleagues, where we agree with that layer on what constitutes care and support and what we need to do, you know, the kind of constitutional mandates that we have. It's always a very antagonistical relationship. And it tends to affect our delivery of care and support to children who need care and support the most. We always get blocked, we always get challenged on scientific and proven interventions. And you find that you are unable to reach the child because we first have to negotiate and we have to understand with that layer that this is a good thing to do. And so what is important about this graphical representation of the ecosystem for care and support is that it has to work in unison and in agreement. Next slide. So in terms of the learner and teacher well-being, the World Health Organization says that well-being is the state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. In fact, they're talking about health because they're moving us from the medical model of health to the much more social model of health. And well-being is important for us because it helps us to provide holistic well-being for learners in the education system. And it's a very critical consideration for schools because it is the basis of education achievement for children. And so when you're talking about well-being for teachers, given that we've got about 450,000 teachers in the system, how do you then incorporate the well-being of teachers in the whole conversation? It says for us, and I think in another slide we're actually stating this, that we now need to move from positioning teachers as agents and deliverers of care and support so that they are now viewed as beneficiaries of care and support before they can deliver care and support. Because we know that if they are well, we know that then the likelihood is that they will also produce well children. In fact, not just teachers, there's another evidence that we've picked up that says that even when parents are unwell, children tend to be unwell too. And I think in the evolution of CSTL, colleagues, we're gonna have to think about in the next couple of years how we also then incorporate parent well-being in the whole ecosystem of CSTL. Next slide. And so these are the pillars, and it's important for me to reflect on the pillars as well, colleagues, because when we talk about well-being, I know that the most obvious are health promotion, social welfare services, maybe safety and protection, psychological support, nutritional support. Those are the most obvious. But there are the ones that are not so obvious in terms of the pillars that we have in South Africa, but which hold a very important, role or position in the lives of children and learners in schools. And these are material support, curriculum support, co-curricular support, even infrastructure, water and sanitation. And this was a big challenge, particularly around COVID-19, when we now had to promote hand washing. And so how do you then promote hand washing in an environment that doesn't have sanitation, an environment that doesn't have wash facilities, for example? And the other one that makes us fight quite a lot, Ndate Matakane, is that one at the top. Just admit this person so that he can see it. A rights-based and socially inclusive and cohesive school, which recognizes the diversity of children and the mandate and the fact that education is duty-bound to ensure that even children with diverse orientations are included in our school system, and we have to talk about it so that we prepare our children to be part of inclusive societies after school. Next slide. So, from policy to practice, when we talked to the 30 leaders that we've spoken to and looking at the literature that is available, but our own reflections also having worked in the system, in 2028, Duncan, I'll be like 20 years in CSTL because of you. But over the last about 20 years, these are some of the impediments that we have identified for implementation. Is that, firstly, inadequate coordination within and across national and provincial education departments. And I think that this one is our own creation as the system. We do need to intentionally and deliberately think about how we're going to almost unify our system so that from national down to province, down to district and to the school, we speak the same language in CSTL. Inadequate coordination of the multiple development partners providing resources. You know, I'm thinking about the area of life skills and comprehensive sexuality education that I'm sure you as the provincial education departments are overstretched because there is USAID, then there's UNESCO, then there is UNFPA, then there's UNAIDS, all of them working on the same issue. And you find yourself having to overstretch yourself because, hi, Wena, don't go to the DREAMS sub-districts. Wena, don't go to the Global Fund sub-districts, but it's the same thing that we're trying to deliver. And so it means that we need to look at that as well because it's stifling progress on care and support. Inadequate knowledge and implementation of CSTL program by schools. They are implementing CSTL, they just don't know that they're implementing CSTL because no one has spoken to them about CSTL. Because children eat every day at school. Life orientation is offered every week at school. You know, there are school-based support teams that are forever busy at school doing so, but they don't realize that they are implementing CSTL. There's also inadequate capacity and support by district offices to schools to operationalize CSTL, particularly through the district-based support teams. We realize that it's not in all districts that we have functional district-based support teams, even though it is a policy imperative for us to have functional district-based support teams in our district, as well as school-based support teams. These are the impediments. But the enablers that we've seen is that when we begin to advocate and communicate, which is something that any city has assisted us, at least in the last 5 years on CSTL, we see that there's more uptake. In fact, in an engagement that I was having with the leadership yesterday, I actually reminded Dr. Khosa that we have been successful in converting the entire basic education system so that it also becomes a CSTL community. Now, SGB associations understand their role in care and support. School management teams also understand their role. Even civil society organizations, they do. And because we've been advocating and communicating quite a lot about CSTL, even for those who don't understand CSTL. And capacity building for CSTL has also been another enabler. And again, we've made quite a big investment in ensuring that we build capacity of provinces and districts to support schools in delivery. Inter and cross-sectional collaboration, which we see beyond Department of Health and Social Development. Capacitation of support structures for coordination and referral. We see that when you work deliberately with school-based support teams and district-based support teams and some of the committees that schools have, it kind of assists us, particularly, you know, when you look at the school safety, violence prevention space, and you look at what we've done there in terms of safe school committees or school safety committees, support for teachers as well. You know, we attended recently a conference for districts that was convened by the NECT, and we had a dedicated you know, engagement on teacher well-being, and we realized that teachers, when in spaces where teachers are supported, they're doing very well in as far as care support is concerned. And then lastly, research, monitoring, and evaluation, which I'll talk about later on in the later slides. Next slide. In terms of advocacy and capacity development, we want to recognize that this is not the sole responsibility of the education sector, and that we need other actors in the space to help us. And it's very important for us to develop great networking skills so that we're able to bring on board all the different actors that hold resources to assist us to advance care and support. Because it will help us to facilitate effective implementation and advocate and build capacity for CSTL, and also help us to coordinate multi-sectoral collaborations, not just with government, but also civil society, with academia, and other knowledge creators that can help us as a sector. So of critical importance is capacity building at all levels to ensure that we make use of some of the instruments that we have developed, like the conceptual framework, the school level handbook, and some of the instruments that we have and the tools for CSTLs that must be used by the schools and those that are delivering on care support. And so we encourage collaboration with partners, because we know that this area of work is the least funded. If you remove the National School Nutrition Program in our funding source, and you remove the HIV and AIDS Life Skills Conditional Grant, you actually find that we are left with nothing. It's always, and I always say this to Dr. Whittle when we go to Parliament, to say that before we talk to them, when they ask us to come and account on care support, we must show them how much money we have. Show them the 500,000 that we have for social cohesion. Show them the 750,000 that you have for health promotion, against 12 million children, against 25,000 schools, and against more than 400,000 teachers. And so that's the reality. So sometimes when people look at the resourcing that is available in education, and they look at those billions and those hundreds of millions for HIV and nutrition, and there's an assumption that we do have the money to do this, and we don't. So that's why it's important that we really brush up on our skills, T-shirt, of collaborating, and we take care of our partners because they bring in the resources. Next slide. Okay, I've already spoken about this. I don't want to spend more time on it. Next slide. So in terms of the structures, we're gonna have to look at the structures at the different spheres of government. The structures that are at the school level, the structures that are at the district level, and the provincial level, and the structures that are at the national level. And all of them, as I've indicated earlier, they need to speak the same language, they need to have the same goals, and they need to have the same focus in order for us to be able to deliver. One of the colleagues that has been with us as long as I've been in CSTL was saying at the Lekgotla that she was hoping that when we go to the Lekgotla, we will focus more on what we have done over the last 15 years, rather than what we still think needs to happen. And that is true. It's been more than 15 years that we've been in operation. And the biggest snag has always been that we're not finding the rhythm between the different spheres of government. And that's why it's not happening as well as it should. Next slide. And so, for teacher support, I've already indicated that teachers are very important in the whole agenda, because teacher well-being forms a very good basis for learner well-being. And we get this mandate from the DBE Action Plan, Goal 17. And the implementation gap is a challenge. But progress has been made in the sense that we now have policies and frameworks and resources that enable us to incorporate teacher well-being in the process. And that's why we're drawing now closer and closer to our education labor, so that they come on board and we work together on this. And we do want to continue to establish the structures that we have for the operationalization of CSTL for teacher well-being. We've started drawing closer to them. We work with SACE, we work with the ELRC, and our own internal teacher development unit in basic education, so that we build the capacity of teachers to be able to deliver. And I've spoken about the paradigm shift, that teachers need not be viewed only as deliverers of care and support, but also as beneficiaries of care and support for that same purpose that I've indicated earlier. And so part of the recommendations for strengthening teacher support are reflected here. Firstly, we're saying that we need to strengthen a multi-sectoral approach for teacher well-being and safety. We know that there is work that, for example, teacher unions are undertaking to take care of their teacher well-being. But we think that those interventions and those initiatives need to be delivered within the same narrative of care and support, because it means that we're not starting from scratch, we're not starting from zero, but we're amplifying what they have already been incubating before we got to this stage. We need to enhance existing structures to prioritize teacher well-being, and we need to identify what those structures are. Do we need to go to the ELRC bargaining council for us to be able to do this, or is there any other structure that exists that allows us to penetrate and incorporate teacher well-being into the conversation? We need to strengthen teacher safety. I know for those who are on social media will see that every day teachers are compromised and their safety is compromised in our schools. And people are blaming a lot of things, you know. Others are saying that because you removed corporal punishment. Others are saying because you removed prayer in schools. Others say, yeah, because there are no values in schools anymore. Others are saying it's because of this rights-based, socially cohesive and inclusive agenda that you brought in schools. People are blaming all sorts of different things as to why teachers are unsafe. Maybe it's important for us to understand why they are unsafe, so that we can then be able to get to the root cause of the problem. But as we identify the root cause, we need not point fingers at each other, because we all have a responsibility to ensure the safety of teachers. And the National School Safety Framework is giving us the space for us to do that. We need to provide infrastructure and materials required for teaching and learning. In that conversation that the NECT had in the district conference, when we spoke about teacher well-being, we asked what are some of the factors that lead to teachers being unwell? And we thought that they would say, health stuff. They would mention health stuff. They were saying things like demographics are very important, and your geographic location is very important. A teacher that works in Lusikisiki versus a teacher that works in Pretoria Central, they've got a different state of wellness because of resources that are available. It's amazing that it's supposed to be an issue of, what do they call it? They call it conditions of employment. That's what it is supposed to be about. But conditions of employment have become an issue of well-being for teachers. That if you don't give me the resources that I need, you want me to deliver these lessons, for example, on democratic and civic education, but I don't have the material to do that. And so it is now Freedom Month. We're going towards the general elections. I need to give that information to my children, but I don't have materials to do that. So civic and democratic democracy education in my school is not happening. Not because I can't do it, but because I don't have the resources, and then I get frustrated, and it just have a ripple effect on that. Provide infrastructure, we've already spoken about it. Build capacity of teachers, we've spoken about that, particularly so that we prepare them for the 21st century skills, for the delivery of those skills. And we need to look at the CS and whether there are any adjustments that need to be made to it now in 2024 going forward. And also we just need to ensure that we create spaces for child and youth agency, and we provide forums for knowledge sharing, so that it doesn't just end with this series today, but that over and over and over we begin to meet. We don't necessarily have to meet in person, but there are also online and digital platforms that can be created for this purpose of continued. Next slide. Continued engagements. I speak like my mother. My mother speaks and then she stops in the middle of a sentence, so you need to complete the sentence for her. Research, monitoring, and evaluation, very important, because we also need, if we want to reflect back to South Africa what we've done, it means that we need to monitor and report and evaluate what we do. But we also center research within that conversation. We've started maybe before I go to that point, I need to also indicate that at the moment it's difficult to reflect on monitoring and implementation using the systemic information management systems, because data integrity is a big problem. We get a lot of researchers that want to have access to our EMIs, to our LURITs, you name it, even SASAMs, and when they get there, there isn't much to work with. And so what you see happening is that the people who are working in the space of research, monitoring, and evaluation collect their own data in order for us to be able to reflect back to South Africa on what we are doing. And sometimes the data that they collect is only in small pockets of implementation in South Africa. We don't really have a national picture of what is happening in terms of our data. We collect data, for example, on orphans and vulnerable children, but we can't tell what the country has done in terms of orphans and vulnerable children. And that data is supposed to be in the mainstream systemic information management systems, but it is not there. But if you go to a school level, that's where you'll find, have you identified learners with no shoes? They will tell you who they are. Which learners do you give food parcels to at the end of the quarter from the food of the NSNP? They will tell you, they've got a list of them. But they end at the school level. There is no place where they can be able to feed that information so that we can have a national picture in terms of data. So data integrity is a big problem for us. But we have introduced, why is it blurry now, or is it my eyes? Pardon? I know I'm diabetic, but it's not supposed to look like that. And so we've introduced now the CSTL research program, because the CSTL research program is going to create a cadre of researchers in education that are going to look at care and support and well-being of teachers and learners. We are starting with the undergrads, and we know that even postgrads are using CSTL as a theory that frames their studies. We've got a couple of universities that have already begun to do that for us. So we're hoping that we're going to build a research agenda in CSTL that will give us better data in CSTL. But I think it's also important, colleagues, to indicate that learner and teacher well-being is not a quantitative agenda. And we get a lot of pressure from our funders and partners. They want to see numbers. What are the numbers? Hey, how far are you going? If you are in the learner and teacher well-being space, it means then that you are in the movement and in the business of changing the world one person at a time. And you need to accept that you may never be able to show big numbers, but you may be able to show a trajectory of an individual child and an individual teacher and a collection of those individual teachers and those individual children in providing them the care and support that they need, and you put them on a different pathway towards health and well-being. So that's why it's important for the researchers, even in this field, to not be bogged down. And I'm not discouraging quantitative research, but I'm just saying that they must not be bogged down with quantity and numbers, because this space is not for that. If you want that, go into the space of furniture, and then of course with furniture, you'll be able to count the number of desks that you're giving. Go into the space of books, because with books, you'll be able to count those books and those workbooks. But here, it's a bit more complicated than that. So the recommendations are that we need to strengthen the mechanisms for M&E. We need to strengthen the CSTL research agenda, particularly in the initial teacher development, as well as the teacher cohorts that are in the post-grad spaces, so that we can enhance the provision for care and support in schools. Next slide. I think the next slide is the last slide or second last slide. Okay, it's the second last slide. What are some of the emerging issues? Quickly, is to just say that if you look at the Transforming Education Summit of the United Nations, you will see there is a list of issues that they've identified there, which South Africa is also grappling with. And we are preparing the country for the 21st century learning goals and objectives. And so it therefore means that we need to look at how the 10 pillars of CSTL are allowing us or enabling us to get there, so that we're not divorced from what is happening in the transformational agenda of education. The second thing that is coming up is the issue around learner agency. A matter that has always come up: what about child participation? Where is the voice of children in all that you do? But what are children saying? We can hear what the SGB associations are saying, what the unions are saying, and what you are saying as officials. But what are the children saying? And so that it's very important for us to then build the agency of young people to drive their own health and well-being agenda. The third issue that we're dealing with right now in CSTL is the whole issue around climate change and education for sustainable development. We see a lot of places, even last week, Cape Town, winds, fire, a couple of months ago, KZN, floods, schools. And colleagues, it's gonna get worse. And so what it means for us is that we need to begin to provide the tools and the knowledge and the skills that are required to firstly drive environmental integrity and education for sustainable development, but secondly, to respond to climate change crisis for schools. We do have a response strategy for disasters and pandemics since COVID. But I wonder if we do have for natural disasters and so forth. And maybe it means that we need to think about what we can develop for schools so that they know, I like the quick response by the Western Cape Education Department of just deciding that, you know what, schools are flooded and we're just gonna close schools, that kind of a thing. And it may not necessarily be the best response, but at least it is a systemic response to natural disasters. And we need to develop something like that. And the last thing that we have not included here is the whole issue that is confronting our sector around diversity and inclusion. And our ability to deal with discrimination and prejudicial positions about the delivery of education. Because whilst we are negotiating on this, more and more children are committing suicide because they feel that they don't belong in our schools. Next slide. And I think that one is the last slide. I'm definitely sure about that. It is the conclusion, Chair. And I'm just going to read what is here because I don't want to mess up Lynn, because Lynn was very clear that this must be the conclusion and it must be read. It says, CSTL is a powerful mechanism for tackling a nexus of challenges key to the advancement of SADC's mission. It is premised on the systematic provision of core and complementary services through the education system, in order to address the underlying barriers to access, retention, regular attendance, and quality educational outcomes. In terms of the CSTL concept, schools are envisaged as sites of integrated and comprehensive care and support, such that each school is a portal through which children can engage services that are necessary for achieving a sound education. So this is to respond to people who say, but why are you bogging yourselves down with all of these health and well-being issues for learners and teachers? Why don't you allow health and social development to do their work? It's important for us as education because it assists us in achieving a sound education. And the SADC policy framework on CSTL intends to provide a unique response to the education challenges that are facing the country, to build on the strengths and collaborations that we have through knowledge sharing so that we're able to provide support to vulnerable children, and that we need to note also that with all our challenges in South Africa, all the criticism that we have about the well-being of children and the fact that we're not moving very quickly and fast enough to respond to health and well-being needs of children and teachers. Actually, in the SADC region, we're the front runners in care and support. We have been able to move on a number of issues, and other countries are still really battling, and they're coming behind us on this. And so I'm saying that as we think about ways and means of strengthening care and support for learners and teachers in basic education, we need to also recognize and pat ourselves on the shoulder that we've done really well in comparison with other member states in the SADC region. And for that, then, Chair, I'd like to thank you. I only have 2 minutes for Andile. If there's anything she wants to add. 2 minutes, Andile. If there's anything strongly you want to mention, particularly from the development agencies. Nini, you are the problem.
Wow. Well, I guess there's not much to add, Liko, except to just reiterate the issues around the value of CSTL in teacher support. We know that for Sustainable Development Goals, we really are pushing for quality, access to quality education. And the trend is to concentrate only on the wellness of the children. However, we have enough evidence to show that unless teacher well-being is considered, teaching and learning will be very affected in the classroom. When we look at the 10 pillars, those 10 pillars do not only apply to children, they also apply to to teachers as leavers. We also, I think, as South Africa, are fortunate that we've managed to get together with universities and do a lot of work around evidence generation, which is possibly something that we can pride ourselves in as we are sharing with other SADC countries. But we ought to be very clear to say the teacher wellness index is very low. And in South Africa, it might even go even lower if we do not address the social, the individual, and the structural conditions of teachers as they go on a day-to-day dealing with their own mental health issues, with their own barriers, but also how that is applied in the classroom. But other than that, I think you've covered everything. Maybe the last minute that we have, we can give to the classroom. And so the environment that we provide for teachers is the environment that will ensure that all children are provided with caring and supportive environments that enables all the teaching and learning, quality teaching and learning to happen. We also very aware that whatever we do in CSTL, I remember in we were talking about the fact that CSTL is not a by the way. CSTL, I mean, if you think about planting a seed, and you're planting a seed in an environment that is not conducive, we have to think about CSTL in that way, to say that is the environment that we need for children, and it is only going to be created if we are taking care of our teachers. Liko had mentioned conditions of employment, which we thought that working conditions are quite important for teachers, so that teachers are happy and teachers are well, and teachers do not have to deal with all of the other structural, challenges in the classroom. In South Africa, I think we've also been forerunners in research and working with universities, starting with University of Johannesburg, and I'm not mentioning this because the chair and prof are here, but starting with the University of Johannesburg and other universities that we are looking at, in just ensuring that we provide mental health programs, we provide structured programs for CSTL, and this is what has attracted other universities. And so as we do work with the teachers who are in service, we have to be thinking about pre-service teachers, and we are hoping that all of these conversations contribute towards how we advocate and influence pre-service teachers. Other than that, we just are hoping that all of this works together as we're dealing with issues of climate change and how they influence the creation of caring and supportive environments, how we're dealing with issues around boys' vulnerability as we are getting into a very peculiar environment in South Africa and other countries, where it's not only just about girls now, it's about how do we then take care of the young boys as we provide supportive environments for teachers, so that they can provide caring and supportive environments for the learners. Thank you.
Unless, Lynn, you've got any burning thing, we've gone over time. We're gonna give to the chair if there isn't anything. Is there something burning?
Nothing burning, thanks, Liko.
Okay, great. I know you are my white friend when you toe the line.
Order.
Thank you, Chair.
It's not caring.
The message is that we must take the mic away from you. All right, so there we have it, colleagues. I'm going to come back to the colleagues again to pose the question, and maybe I should pose it now. So if the minister was sitting right here now, what would you say to the minister? What are the top 3 things that we need to give attention to? And remember those other questions that I suggested we think about? What is it that we're really doing well? What is it that we need to improve on? What is it that we need to make a U-turn or a big shift on? Keep those in mind as well as we move along. But allow me now to invite Prof. John Volmink to offer his reflections on the paper. Warm welcome to you, John.
Yes, thank you very much. I'm sorry, it's a nice day in Cape Town, but I've been affected by the 7 other days that it was not. So my voice is a bit croaky. I just want to say thank you to Liko for that excellent presentation. Not only what he said, but how he said it. Except at the end, I think he went off script. I must say that every time I hear people like Liko speak, for me it's a learning opportunity. So I speak today with my MIT Africa cap. And if you allow me just comments about the ancestry of this concept of CSTL. Any concept has an ancestry. And the part I want to talk about is just a small little estuary that flows into this river of consciousness about well-being of learners and teachers. And so I want to start by saying I've been part of MIT Africa from its inception in 1996. And since its inception, we were very fortunate to have the white paper of education, on education, published a year before we got established. And so we had that as a guide. And this, together with several other subsequent policy documents, guided our thinking as an NGO as we debated what our core purposes should be as partners with governments, which was always a question that we asked. And it was also fortunate to have had as visionary leadership people like Lynn van der Elst, support the most impoverished school communities in KZN, where we were based, and elsewhere. We would need to broaden our understanding of education. The traditional 3 R's approach alone was not sufficient. We needed a more holistic development, and therefore it requires all aspects of a child's life to be considered: physical, intellectual, emotional, social, and spiritual. All of that makes up well-being. This was highlighted for us in the late 1990s at the height of the AIDS pandemic, where schools were faced with enormous challenges, such as orphanhood, such as child-headed households, and illness and death. And so MIT's Africa's response to these challenges, laid bare by the pandemic, was the development in 2000 of the schools as centers of care and support program, and that was implemented in partnership with the KZN, provincial government, the EC, the Eastern Cape, as well as the Northwest Departments of Education. And it aimed at strengthening schools as hubs in and through which support and services could be provided. So, based on positive results, the program was scaled nationally and to Eswatini, as we heard earlier, and to Zambia. And in 2008, it was adopted by the SADC education ministers as a regional program, renamed Care and Support for Teachers, Teaching and Learning, CSTL. And so I want to say just a few things, 6 things to be exact, and then I will stop. I want to say 6 things about the CSTL. Number 1, CSTL is a good example of an NGO-initiated intervention that, through partnering with governments, essentially, became systematized through the mainstreaming of care and support in accordance with coherent national plans instead of working in silos. nothing more damaging than walking apart. So the first thing is partnership. So, which I also can express as a second point, that CSL demonstrates the importance of partnership and collaboration. Now, you've seen that little diagram with the girl in the middle of the picture, and that picture aptly illustrates, if we haven't touched the life of that person, that girl, we haven't done anything at all. And what can be achieved, we need to ask ourselves, when partners come together to work towards a common goal. And I think although good work is being done, one of the answers to the chair is, I don't think there is sufficient collaboration at the local level. Number three, CSTL has also shown the benefit of a multi-level cycle of influence. So we had local initiative, then it became national, then it became regional, and then when we now get together, we learn from the regional, and so we go back from regional to national to local. And that multi-level cycle of influence is one of the benefits of this program. Number four is it actually illustrates, CSTL illustrates that although there is no quick fix to development challenges, it demonstrates clearly what can be achieved if there is a shared long-term vision with a long-term commitment by all partners. That commitment is very important, and we are deeply grateful for the various partners for their commitment over a period of years. Fifthly, at another level, the discourse and practice of CSTL has helped us to push back the boundaries of our own understanding of some of the key ideas. For example, the introduction of White Paper 6 in 2001, which narrowly understood it's about inclusive education and so on. But the introduction of that white paper within the discourse that we are talking about of learner and teacher well-being helped us to extend our understanding by highlighting the role of barriers to learning and the need to provide system support for the various barriers learners and teachers face. And then lastly, sixthly, CSTL highlights the need not only for support, but also, and very importantly, for teacher and learner agency. Nico touched on that a bit, and I'll just say, what is agency? What do we mean by agency? I would say agency is the capacity to take purposeful initiative, and it's the opposite of helplessness. Learners with high levels of agency do not respond passively to their circumstances. They act with purpose to achieve the conditions that they desire in their own lives. They take charge of their own experience. Teacher agency also is often defined as teachers demonstrating the capacity to act to address their challenges. And teacher agency is the capacity of teachers to act purposefully and constructively to direct their professional growth and contribute to the growth of their colleagues. And I just want to say, if we only talk about teacher support and learner support without teacher agency and learner agency, we are now feeding into the whole dependency syndrome. And we have to work towards a point where teachers take charge and learners take charge of their own experience. choices. And one of the most important choices that I believe needs to be made is that, or to be realized, is that you can choose anything, but you can choose to care. You can choose to care. Caring is a choice. And I believe that the CSTL is where it is today, making the progress it has made today because of an ethics of care that started in the white paper and continued through all the different administrations until now. And so we are never going to succeed with creating teacher and learner well-being if we don't have a spirit of generosity. And I don't mean personally only, I mean policy-wise. There should be a spirit of generosity within our policies. So as I close, the success of CSTL can largely be attributed to the ownership and leadership provided by the DBE, and I want to acknowledge that. And Nico has said that we are the front runners in the whole region. And since the adoption by the SADC education ministers of the CSTL policy framework in 2016, a lot of progress has been made. And I don't think we must underestimate the achievements that we have made. And it is in this regard I want to commend our own Minister of Education, who has been a champion of the whole child, ensuring that South Africa leads the region in mainstreaming care and support. Yes, I know we're not perfect, but we've made a lot of progress. And I think it's important at an occasion like this to acknowledge it. Thank you very much, Chair.
Thanks very much, John, for those very important and insightful comments, in particular helping us again source the ancestry of the position that we find ourselves in today, and again highlighting, emphasizing the importance of partnership, of collaboration, of agency. And I want to simply extend the idea of agency from beyond learner and teacher to parent, to community. So agency coming through is a very powerful and important activation that we need to secure across the more than 400,000 teachers and more than 12,000 learners, and shall I say similar numbers of parents and community members. And I look at our SGBs. I see one of our leaders in the room here, and I see other of the leaders online. SGB agency, equally important. So thank you so much for connecting us, as you put it, to the ancestry, the river of consciousness about CSTL, as you so eloquently put it. So, Jace, over to you now. Warm welcome.
Thank you, Chair. Can you hear me? Good morning, colleagues. Chair, I think I had my mind set on what I was going to say today, and you, of course, complicated it when you posed the very important questions that need to be answered here today. So I'm trying to think as I share in terms of framing what I'm going to say aligned to your questions. So I'm also not going to share comments around the review that I did, because the review was based on improving the quality of the paper that was presented. So it was a different kind of angle. So what I want to do today is actually share some of the things that are said in the paper that, going back to your question, what are we doing? Are we doing it well? So I want to pick up on those parts in terms of what we are doing and if we are doing it well, and what are some of the challenges, and going back to your question on what are the areas that need to be improved. So going to the first part of the question, if you look at the document itself, and much of the things seems to be very theoretical, but I think that's a myth, because many of the things that are said in this paper are actually practical things that are happening as we speak. So it's not something that we're waiting to see to happen. It is already present, and as Liko said earlier on, is that CSTL has always been there. We just never put in some concepts to it. So what are we doing well? We definitely are doing well when we have identified the social, economic, and the political context in relation to CSTL. And I think the presentations clearly articulate that, because the social issues that we've shared there in the paper are many of the issues that we have to tackle as part of this process. The economic aspects in terms of poverty is critical. And of course, changing political landscapes are critical as well. And going to the question that you also posed, what do we need to say to the new or the incoming administration? And I think that's a very important question that this meeting today needs to actually address. What else have we done? We have improved and looked at the rights to education for all children, and the emphasis is on all. Even though we know it intersects with other rights, such as protection and care and support and healthcare and nutrition. We've also looked quite a bit in terms of vulnerabilities, and numerous vulnerabilities were highlighted in the presentation by Liko. In fact, there was one slide there that was very populated with the vulnerabilities. So I think we take cognizance of the different vulnerabilities, but I think I also want to caution that we are not going to get solutions for every single vulnerability that's identified, whether it's in teachers or whether it's in the learners. So what we need to be working towards is looking at core principles and fundamentals in terms of addressing all kinds of vulnerabilities. And of course, we will modify that as we go along to particular ones. The other thing that we see that's quite well kind of indicated in the paper itself is the multi-sectoral need in terms of action that has to be taken. The ecosystems and the bioecological systems approach comes out very, very strongly, and we definitely see there's a need for systemic action. And I think in the South African context, we see this quite strongly. And I think in our interaction with the colleagues from the SADC regions, that's something that seems to be lacking. And maybe that's where, Liko, we take the lead in terms of South Africa with regard to that particular aspect. And of course, our policies on inclusive education and coordination and partnerships really had value in terms of what is being done currently with regard to CSTL. Moving into the critical aspects that this presentation deals with. One was the CSTL policy environment. Two is the extent to which care and support is integrated into various components and levels of the education system. Three, stakeholder views. And four, emerging issues and opportunities. So I'm not going to say anything about those particular areas because I think the Liko in his presentation covered those parts. So a lot has been said in terms of well-being and also the emphasis on the vulnerabilities that I just spoke about. We need to know that teacher well-being is also essential for learners' well-being. So it goes together. And Chair, you've actually highlighted that, and Dr. Godwin also pointed out. If our teachers are not in a good space, then we can expect that whatever they do with our children is also going to be affected. So learner well-being is actually crucial. And if you look at the issue around learner well-being, we all celebrate the fantastic grade 12 results that come in every year. So it's 80% pass or 70% pass, and we really celebrate that, and of course we should. But what concerns me most is the cohort of learners that started from grade 1 to grade 12, and by the time we get to grade 12, we already know that between 30 to 40% of those children already dropped out of the school system. So what we are doing here today in terms of CSTL is crucial, because it's going to cater for those children with those vulnerabilities and those children who drop out of the system, so that we can really, really celebrate in a very genuine manner to say that all our children, or most of our children, who started in that particular cohort have made it to the grade 12 level. So my point here is that we have to be cautious about our celebration, because how are we doing enough to ensure that all children get what needs to be given to them? So getting to the areas that Liko spoke about, the 10 pillars, and also our colleague from the SADC region also touched on that as his opening remarks. What are some of the concerns that I need to highlight here? First of all, that all these theories are integrated in theory, right? But in terms of practice and policy, we might see there's gaps with regard to that. We often see that these 10 pillars or priority areas are operating in silos. So what happens, for example, in psychosocial support, right? Sometimes may be divorced from the curriculum or co-curricular support. So we see that this distinction in these particular areas is problematic. And I think this is clearly evident in terms of how visible this is in government departments and how they operate. So I do understand that every government department has its own KPIs and vision and mission and budgets and different ways of doing things, and everybody wants a slice of the cake. But to me also this is problematic, because if the departments could engage with each other jointly in taking on projects, for example, let's say it's a CSTL project, so they can actually make available all in a combined way, physical, material, human, and financial resources. So I'll give you a simple example. I was invited to speak in a HIV AIDS conference a couple years ago by the Department of Education. So it was a lovely occasion. Money was spent in a fabulous hotel, and I said what I needed to say. And a couple of months later, the Department of Health invited me to do exactly the same thing. And I remember saying to the organizers, did you not speak to the education department, because I actually, they had such a lovely occasion. And they said, no, we got money to spend. So we have to spend those money, right? And I just sat there and I said, okay, imagine if they got together and shared the resources that they've had, right? What a good opportunity that will be. So the big problem that I'm highlighting here, Chair, is the kind of interaction that we have across departments. And I think for the CSTL policy to survive and to even make an impact, we need to touch that base. And I'll give you another example. When I launched the Child and Youth Mental Health Profiling System in South Africa, and it came through the Gauteng Premier's office. And that very office tried to bring in all the different departments with regard to this particular project. And I was very disappointed. The room was full with people from the education department and hardly any other people from health and social and so on. So that tells us a lot in terms of how we approach things. So that will be one of the major things that I want to highlight as an issue that we need to focus on. In the last 30 years, we have very, very good policy documents. And I think even in the South African context, we can boast about all the policies that we have. But unfortunately, we've become paper tigers. So we're very good on paper, but we fall short when it comes to the implementation process. And I think that's the other challenge that we need to be looking at as this particular area in terms of the 14 areas that you've highlighted. So therefore, building capacity for strengthening policy awareness and implementation is crucial for CSTL to become a reality in schools. and definitely we need to be improving on that area. Our policies are very well shaped to include communities in learners, and also teacher well-being. And this is paramount in terms of the CSTL policy and process. So the other issue that I want to highlight is the issue in terms of building up the advocacy, as Liko spoke about, and capacity building. So I think we, in the last 3 decades, have started to put in care and support on the agenda. And it has been there, but maybe in disguised ways, or in no direct ways. So I'm so glad that we now are having this meeting. In the last 20 to 30 years that I've been involved in this particular field, I cannot remember a particular meeting where we had people coming together to talk about this topic in particular. So I think we really are doing well in that particular aspect. The fact of the matter is that if children are starving and we're trying to teach them maths and science and technology, how are we expecting them to concentrate in the classroom if we haven't taken care of their nutritional needs? How do we support children who's dealing with grief and poverty issues, and they're thinking about those things when they're sitting in the classroom? So we need to be looking at the services that we provide that's going to facilitate the actual learning process in terms of our children as well as our teachers. So I like the idea in terms of the networks that we've created with regard to the SADC region, and I think that's quite remarkable. So just going to the challenges that was raised, and I think mostly those challenges in this particular paper, Liko, was around the coordination process. But I think the important thing is around the budget. And it's not as if we don't have money. We do have the money. The problem here is that we do not spend it where we think it's supposed to be well spent. So for many years, I think that government departments have not put money into CSTL, thinking that this was, by the way, a side road and not giving it the priority that it needs. And I think COVID-19 was really a bad experience for all of us, but it was an eye-opener to show that the mental health and the emotional well-being of children and teachers are quite critical. So I think we need to put our money where our mouth is in terms of budget issues. The other thing with regard to the challenges that we experience, which may not necessarily been covered in this paper, is actually the ethical considerations. Now, we need to do everything in our power to obviously protect the rights of children. And I think we're doing a very good job in doing that. But the problem also happens is that we have so many rules in place, especially, for example, at a university level, where it's so difficult to do research with children. And part of what we're talking about in terms of the CSLT policy is the research component that was shared today. And the question then is basically, sometimes these rules inhibit us from doing what we're supposed to be doing. So I'm not saying that we must take away the rules. I'm simply saying that if we know that there are areas that we need to focus on in terms of children who are vulnerable, we need to create opportunities in terms of doing that. So that's one of the challenges that I have seen, but mostly within the context of universities. We just concluded a very big study on looking at the harmful religious practices in terms of things that were happening in our schools recently. And I think we took more time getting ethical clearance for that research than actually spending the time on the research itself. So, Chair, in concluding, I would like us to see that what are the envisaged benefits. So if we are looking at this process, what are the benefits? And who will be the people that will benefit from this process? Obviously, it's definitely going to be the learners, the teachers, and the families and communities, as you mentioned just now. And we also have to look at the societal impact that this particular focus is going to create. And of course, we need to look at knowledge and theory production, and of course, policy and practice that's going to talk about this. So I would actually be very pleased to see if what we do creates an opportunity for our teachers and our children to be able to have a set of skills that will enable them to be resilient and to deal with any situation in terms of having that core elements of resilience. So we take COVID-19 as an example. So the kind of skills that we create is that they will be able to deal in any crisis situation. So I'm hoping that's one of those things that the CSTL committees will be able to take quite seriously. I think also we need to be looking at the agenda that, as you said, in terms of government. And I think the current steering committee has demonstrated that we are taking this quite seriously. And there are things that have been done. For example, we've had the special journal issue that's coming out, and we're in the process of doing that with CSTL. And I'm also glad to say that our SADC colleagues are part of that process. We have had conferences and symposiums that took place, and we've had also taught leadership debates with regard to leadership issues. We've created a research forum. All of those things are happening right now, and those are some of the things that we have to celebrate with regard to this process. So, Chair, in concluding, I would like to say that I would like to emphasize the point that we need to create a community of care and support, for care and support to be in the community. So that's a very loaded statement that I made, because we'll have to unpack it in terms of what needs to happen for that to become a reality. And going back to what John said about care, I think we, as this particular area with regard to the focus point that Godwin has indicated, we must dare to care. Thanks, Chair.
Thanks very much, Jace, reminding us that care is everyone's business. And that is the culture that we need to embed. Also reminding us of some of the areas that we need to pick up on. Intergovernmental collaboration that is program-based, as opposed to operating in silos. So, can you hear me online? Yes. Okay, cool. A strong focus on intergovernmental collaboration with a program-based approach. Strong reminder that we are strong on policy but weak on policy implementation. Or put differently, we have to up our game in the policy implementation space. And challenging us to think about what is a resilient learner, and how do we nurture those capabilities. So thank you very much for those. I've just picked on some of the points that you have made. You have highlighted the importance of our multi-sectoral action within an ecosystem, that we've made progress there. The challenge for us are the ones that you have highlighted. You made the point that there is a need that we need to focus on systemic action, and so highlighting some of the key and important actions, interventions that we have to take to get to a point where everybody's business is care and support of learners and teachers. So colleagues, we've listened now with great care, great detail to the conversation. In particular, our colleagues online have been very patient. We have 103 colleagues now online. We peaked at about 112 colleagues, and we're most grateful for your contribution on the chat or in the chat box. In the chat box, you'll find the register. Please, if you've not yet registered, can you click on that link? It's a safe link, I promise you. It's our link. And once you've clicked on it, you can register your details for this dialogue, but also for future dialogues. Thank you so much. So there are some comments that have been made in the chat box. Very complimentary comments about the fact that we have today this conversation, that we're not in the margin, that is actually center and core of the conversation. As you will have heard, this is the fourth in our dialogue series, where we're focusing on wellness, on well-being, on care and support for learning and teaching. There are some comments. One of the comments, Liko, says, changing conditions doesn't manifest immediately as a quantitative shift in achievement and outcomes, but it will change the learning experience for all learners. And when the conditions are correct, all the learners exposed to them should show dramatic shifts in performance. But as the message continues, as we know from design research on this form of change management, shifts in conditions take approximately 5 to 10 years minimum to embed, and this process needs to be intentionally supported over such a 5 to 10 year period before it becomes normalized and comfortable for people. The issue is therefore so urgent, as the colleague puts it, that we just have to slow down to attend to it. Interesting and important observation. Then a comment, Liko, can you share more about what qualifies South Africa as a front runner in CSTL, and then how those outside of the DBE can play a role in continuing to support this crucial work? Then again from Robin Whittaker, he makes three observations, she makes three recommendations. Pay exquisite attention to creating the conditions. Yeah. 2, focus on the power of the dialogic process and creating time to think for all stakeholders in the system. In brackets, slow down and refocus from the product and outcomes to the process, relational spaces, and thinking environment present. And then thirdly, grow the capacity for many others in the system to do the same at the different levels that they occupy. The conditions for care and belonging in schools, in circuits, in districts, and all structures within the system. Create the conditions for care and belonging. There's some further observations. Can colleagues share more about how we have come in reaching the teachers in schools across the country? Is there data available, or at the very least a sense of what has worked and what has not regarding teacher support and development in regard to CSTL? A further comment, Nadine, teacher and parent agency and assets are largely ignored in their potential for collaboratively networking with other professionals. And then imagine if we spend our budget on strengthening the process and conditions that facilitates CSTL rather than chasing of specific programmatic outcomes and justification metrics. When the conditions, humanized and humanizing learning spaces are correct, the results will follow. And a further comment, we seem to talk too often about brilliant policies and continue to lament about policy implementation. So what do we need to do to up our game in policy implementation. Prof. Pillay, what suggestions do you have for monitoring and evaluation of the actioning of progressive policies for multidisciplinary engagement? Please keep those comments. I'm going to come back to you now in a moment. But let's just hear in the room first, are there any observations, colleagues, any issue that you are passionate and concerned about? If you could raise your hand, introduce yourself, and in 2 minutes, try and articulate that point. Thank you so much.
Thank you very much. My name is Nareen Naidu. I'm from an NGO called Higher Health. And I'd like to just pick up on a few points that have been made, but just use an example of how this is actually being implemented in higher education. Prof. Volmink spoke about partnerships and agency, and you, Prof. Rensburg, actually extended that to the community. And Prof. Pillay talked about research, and I'd like to pick up on that. And I'd like to start with Liko's point on that this problem is an education issue and not health and social development. So we are an NGO, but we partner with the Department of Higher Education and Training, and we are responsible for not just care and support, but we call it health, well-being, and development of students, as well as all the lecturers and staff at all PSET institutions. So where PSET institutions are well off and can afford their own infrastructure, we provide them with funding, but in most other institutions, we physically provide support, where we have mobile clinics, nurses, social workers, etc., that actually visit the campuses. Now, the way in which we handle this issue is through education, because we believe that knowledge is power, and with knowledge, you can allow that agency for a student as well as a lecturer or teacher to actually take responsibility for their own health and well-being, and then also know what resources are at their disposal to actually deal with the issues that they have. So we try and reach at least 80% of the student population in any given year, and we have several dialogues with them about issues like gender-based violence, like mental health, etc. So in a year, we have about 6 or 7 of these interactions. And during each of these interactions, we actually give them risk assessments to complete, so that a student can decide for themselves whether they are actually at risk of being a victim of gender-based violence or having a mental health issue, etc. But we don't leave it there. We link them to care. We have a 24-hour crisis helpline that students can reach out to us through. We also have psychology services, and we partner with the Department of Health at a provincial level so that we can actually refer students as well as lecturers to institutions closest to them. So this model has worked very well because we found that we can actually quantify the numbers. We've got a lot of data in terms of what we've been doing this for over 10 years. But what we found is we can reach many more students and lecturers if we put this program online. And students were saying, we want this to be accredited because you are providing us with so much of information. So we've developed an online program with 8 modules. And these modules are being offered in all official languages, including sign language. We are also speaking to universities to make this compulsory for all first-year students to complete as a co-curriculum. Now, a few universities have already taken us up on it, and it will become compulsory in 2025. And we are working with other universities and TVET colleges to see how we can bring that on board as well. So what we are saying is where your teacher well-being is concerned, if they are at one of the institutions where it's compulsory for them to do this particular course, we are not only giving them knowledge, but we're also giving them the tools to deal with issues and to bring that knowledge into the classroom. So that's one of the mechanisms that we are using. We are also linked
we're
with...
constrained with time, if you could...
we also linked with Tutuzela care centers through the NPA. So there's a lot of partnerships that we work with. And we have all of this data in a repository where we are encouraging universities, etc., to actually use this information for research purposes. I'll stop there. Thank you.
Cool. Thanks very much. I just want to encourage colleagues that if you can go online and search higher health, you'll get an insight into an NGO that is working with the college and university sector in this space that we are reflecting on. So interesting initiatives in place, and we've just had a quick snapshot of some of the important work being done there. Please, let's go ahead.
Thank you very much, Chair Tabang Bebe from Agape Youth Movement. What came up strongly, particularly from Liko's presentation on the paper and as well as the remarks made by Prof. Volmek, is the issue of learner agency. And what I'd like to contribute, because I feel very passionate about it, because that's this particular space that our organization works in, particularly with the Representative Council of Learners. Now, if we want to talk about learner agency, we need to find a vehicle to drive that. And I feel there's a missed opportunity, because in every school, by law, you have this, the SASA access that there must be a structure that represents the learners. And with the framework that we've been working on together with the department is that we've made sure over the last couple of years that every province has a structure, every district has a structure, every circuit has a structure. And I feel like if we can take advantage of those structures from a policy perspective to help contribute towards the framework and shape policy, and also use them as agent of change to drive down the change in the schools themselves, would then be achieving more. Because if you realize something, I get elected as a president in my school, I can drive interventions. But at a second level, there is no school. So what interventions, what am I doing elected at that level? Same at the district level. We just elect these learners, they meet once a year, they never see each other again. So those are the structures that we should be using to drive this learner agency. And you can hit two birds with one stone, because every time a learner moves from a school to a circuit to a district, they move with a TLO. Because of the policies of the department that learners can go to travel alone and attend events alone. So you can empower the TLO as well as you are empowering the learners. So you are driving teacher agency. But the learners also sit at that level. They normally sit also in the SGB. They are full members of the SGB. So you can also help them to bring up some of these issues and drive SGB agency. So I think that's the approach we need to take, because we have these structures existing. There's a management plan. All the provinces currently all have structures, but there's no program of action, there's no framework to capacitate them. And we've recently developed the RCL handbook, which puts the CSTL framework as the foundation of one of the mandates of the RCLs. And I think that opportunity those are opportunities that should be taken advantage of. Thank you very much.
No, thank you very much, Chair. I just want to raise, firstly, one would like to comment the papers. I think South Africa has been taken to school this morning. Comment all those papers. They shed serious light in the education. Listening to the papers, I picked on I think 4 areas. One, I think they have already elucidated on it, policy and practice. I think there's a problem there. I think South Africa has got beautiful policies in education, but the implementation phase is failing. If one is to give an example, is that I think the Department of Education wants to address the question of language in the country. They have a policy which is called incremental introduction of African languages. It's a problem. they cannot. Some established schools refuse to implement that. Now, you see, I don't know whether department is unable to do that. You know, that's the problem of implementation. And also, when you come to governing bodies, it is clearly stipulated that the role and responsibility of school governing bodies are the following. For instance, the selection and interviews and recommendation of staff is the role and responsibility of school governing bodies. But people who have influence, they take over the power of school governing bodies. But it is really clearly in the law that is that's the space of the school governing body. So I think we have to look into question of practice. I think Professor Linko also raised the question of the donor funds. It's a problem. It's a really problem. You know, I was defending Limpopo Department of Education recently, I think 2 weeks, where I think the funder just gave the NGO that sit on their necks and all. I don't know what was the objective. But the question of the latrine toilets, it's a national problem. It's a national problem. And I'm not saying we should not sit on their necks, but you must also understand. So it's a problem because when you are given that money, you are told that don't even blink, do this and all this. So I think it's a real problem because finally it makes the public to lose interest in the education that we are trying to build, you know. So I think that's one other area that we really have to look into. We have to strengthen question of parenting and parental involvement. I think it's lacking a lot, parenting and parental involvement. What type of parents do we, I don't know how we're going to do this because we lack the question of the teens, the twins. The twins, I think, the age of 8 and 13. And if a 13 old parent or child makes a child, so I don't know whether he understands or whether she understands how to parent that child. So it's an area that's why now you'll find that now teachers are being beaten in schools, teachers are disrespected, and also, I don't know, Professor, because it's at your level, university level, I don't know what are you teaching the teachers themselves because, but they know that there is law, but they still become romantically involved with the children and all those things. So, but they know that is, and some of them, lots of them, they are being, and I don't know where SACE, because SACE also apparently is unable to implement, also to monitor and evaluate. So maybe it's here, but it's hearing, because it has been forced right now to change its policy, to say no, because they are in court. SACE is in court now. After all these years, I mean, we are getting to 30 years that you are still being taken to court to update that. But lastly, I think the roles and responsibility, I think I've talked about the roles and responsibility of the school governing bodies. I think it's a very, very serious matter that if we want to see care, support, and teacher and learner well-being, then I think question of, because they are the government of the school. There's no way, whether we are not learned as parents, it's neither here nor there, but the policy says school governing body, largely it was made of the parents, and that's it. It is that. Whether they are learned or they are not learned, but we must have a way of how do we strengthen parents in the school. And by putting Chair, and I think you'll remember that in the end 70s, the 80s, we were talking about the triangle, the teacher, the parent, and that's the image of NECC. I think we're part of that NECC, and I think now it is practiced now. Some of people may not know where it comes from, but there it is, school governing bodies. We have put the principal, we have put and the teachers are there, and people will always say, no, choose parents that will know. We say, no, there are teachers there. Principal is there. Support staff are there. They have to educate the parents, because parents are not in the business of education. Thank you.
Thank you very much, Butwam Matekane. You didn't introduce yourself so that people could understand what your context as still the Association of School Governing Bodies, the boss there. Thank you very much. If there are no further comments in the room, okay.
Thank you so much, Chair. My name is Siziwe Molwana. I'm from Gauteng Department of Education, based at Johannesburg South District. I'm the CES for Values in Education. I just want to take this opportunity and appreciate all the papers that have been shared. Quite informative and loaded papers in terms of, the way forward. I want to pick up on what Liko presented. But first, I want to concur with the speaker behind Liko, who picked up on the issue of learner agencies. That's very true. And I think I am happy and in agreement with the work that you do. And just there, as Values in Education, we are one unit at all the districts that is driving the mandate of rights-based and socially inclusive and cohesive schools. Now, on the ground at our schools, what we have done, we have established human rights ambassadors as well as flag bearers, because we are saying to our learners, let them be groomed to be responsible citizens who then become patriots. Because the work that we do currently is not yet legislated, just like the RCLs, we then collaborate with them in terms of driving that agenda. Secondly, I also want to concur with Date Matekane with regards to capacitating and empowering parents, because in the work that we do also in Values in Education, we work a lot with parents to say, let us collaborate and ensure that each school is a conducive environment for teaching and learning, and each school speaks to our mission as a sector, where we are saying we are to provide functional modern schools that enable quality teaching and learning, which will promote and protect the right of every learner to this quality, equitable and relevant education. So we drive that agenda with our parents, because like he said, they are very much influential and they are key decision makers at school level, working with the SMTs. Now, the other important thing that I picked up is the issue that Liko indicated on his presentation of insufficient schools. I want to commend the DBE of the work that has been done now towards intervention to insufficient schools. Because at my district, for instance, just recently we have received 2 satellite schools, which I believe it's something, going forward in terms of intervention with regards to insufficient schools. Because the very insufficient schools, they have a negative way of impacting on learner well-being and educator well-being, because now the classrooms are so overcrowded, so much that it culminates to a conflict between the educators and the learners, in that classrooms are uncontrollable. And when teachers are frustrated, because they are emotional beings, they are bound to, lash out on their learners, and a conflict right there arises between the two parties, who are supposed to be working harmoniously, by the way, so that at the end we are able to say our learners are performing to the best of their abilities. So I think if DBE can enhance on that one in terms of rolling that out so that it reaches all districts, and not only that, I think via partners as well, we, if possible, let's try and establish more concrete schools, because these mobile or container schools are really problematic, especially winter time. See, now the season is changing, and those who are having their lessons in containers, it becomes a problem. And even on rainy seasons, it becomes a serious problem, because classes get flooded with water. Lastly, I also want to pick up on the issue of low literate parents. You see, this becomes a big issue, ladies and gentlemen, and it directly speaks to the layer that Liko indicated on that CSTL picture, where there's a learner at the center, our Sintibaling hope. Because of these low literacy levels of our parents, they then are not sure of what is their role. And when people are not sure of what is it that is expected of them, they are bound to be frustrated, and they are bound to be defensive, which is why now it's not easy for those who are coming in with these support and care services as partners to actually now infiltrate and reach the parents, because anything that the social media or any other communication space will pick up as something that's wrong, everybody is going to say, and we cannot allow that. So, but if we engage our parents, find a way of capacitating them, informing them of our intentions and how those measures are going to benefit all of us and our children who are the learners at our schools, then I think there will be no way that they will not be agreeing in terms of what is coming as a support measure. Lastly, I know Liko said DBE encourages collaboration with partners. We truly appreciate that. However, it is critical that as we do that, we screen our partners, because we wouldn't want a situation where we collaborate with an aim to assist our learners and give care and support, all to find out we are harming our children one way or the other, because the people we're working with, they are not cleared in terms of, all these other unbecoming sort of behaviors. Thank you.
Thanks very much. All right, colleagues, we've had quite a few interesting and important contributions and questions raised. Butwam, there are some interesting points on the chat box here. A reminder that the Regional Education and Learning Initiative, this is from Robin sharing the information, RELI, has just published a very interesting framework on parental empowerment and engagement that is a product of 3 years of research and dialogue. It would be great to cross-reflect on this document for the SADC context. There are also excellent materials on life skills and values in their publication called Alive. And there is a link placed also on that material. So that would be interesting perhaps for you and all of us who are interested to follow up on that as well. And then just colleagues also, we've just posted the evaluation link and would really appreciate it if you could find the moment just to complete that online in the chat box as well. So we're now at 12:32. I looked at the colleagues in the virtual meeting room. We're down to 94 now, and so we've lost about 20 colleagues in the conversation. Veronique, are you still with us? Is there anything you'd want to share with us this morning?
Yes, I'm still here.
Any observations from you?
The observation I want to make is firstly the honesty with which people are speaking and the honesty with which, the humility with which it has been accepted. I'm a doer, not a talker. And so I am very excited to be invited to a follow-up conversation. So how do we actually now start doing the collaboration, and how do we start rolling out? Because there are many of us that are eager to hold hands with the NECT. Godwin is also very good at holding hands with good people. I really like the last comment that was made, that we need to be very careful of who we invite into spaces to be supporting the work that we're doing. So Godwin, I'm waiting for the invitation of a follow-up, because these dialogues are amazing, but there needs to be follow-up. I'm a click, let's go, and as you know, Iran, our interface, it's time that we start doing that.
All right. What do we say? Siamkele. Thank you very much for those for that guidance and for that reminder. Just to remind us, of course, that our objective really is to define a pathway for the next administration, to counsel them, to give them wisdom, to give them advice. And Godwin, there for you and Liko is also a challenge from Veronique. Can we have the follow-up conversation and do the action part of it? If you could give some thought to that. So I'm going to now invite responses from colleagues. Let me begin with Godwin. I'm sure you've got some reflections, and then we're going to move just across the room. Prof. Jace, there were some questions for you. And then there were a number of observations for you, Liko, and the team. You should feel free then to draw in the team into those reflections. But let's start with you, Godwin.
Well, thank you, Chair, and to Veronique. I mean, we've had your suggestion, and there will indeed be follow-up, conversations in this regard. Duncan would actually, propose how we take these things forward at the end. But Chair, I just want to reiterate some of the observations that we made, and I think, positioning and commenting by the team that prepared the paper, that's actually, I think, understates the amount of work that has been done in this space. If I compare CSTL to other, areas in education, I think this is one of the areas of the greatest development in the past, 2 to 3 decades. So congratulations to those people who are at the center of driving CSTL, and I do know that's a few people. I could pick up that there, from the CSTL framework, there are some, in fact, from the entire, paper, there are some key drivers of change that are, suggested. One is the conceptual framework, which is presented in the CSTL framework. But clearly, I mean, LICO has identified in many ways the importance of resourcing and providing resources to this course, structures, establishing structures that drive the business of CSTL, building capacity, which has to do with teachers, and the research that the core group has embarked on with universities. And I think that's very important in building an evidence base that would, support development in that regard. And the last one that I could pick up is the modus operandi for driving, CSTL forward. We don't have the time to delve into those, but I thought if we took that, we could start responding, for instance, to Robin's questions about where are the opportunities for collaboration. I could identify two of them that I think the core group should look at. One is, I think, in the context where we have to continue to drive development through matrix management, we have to identify a few priorities that everybody in the sector could collaborate around. And it's a difficult thing, but we have to get to a point and say, within the framework, in the next 3 years, this is the hierarchy of priorities, and anybody who want to actually support, this is how we work, together. And I do think that Prof. Pillay is suggesting an approach, in fact, confirming an approach that's emerging out of this, a networking approach that actually assumes particular roles of the state and the non-state players, and how all of those should come together. And it goes to Robin's question, actually, about collaboration and how we take it forward. Lastly, I think we have to seriously consider, and I'm talking here to potential partners, working with the drivers of CSTL, at the center of which is the DBE, as well as the beneficiaries. And two big beneficiaries that, at the moment, I think, aren't actively drawn into the CSTL broader network, even though they're doing some kind of work. One of those are teacher unions. Teacher unions are busy doing a lot of CSTL work relating to teachers. The second one is the youth. And I think we've not been doing enough in the youth space to support, youth development, and whether it's, focusing on building the resilience that Prof. Pillay has spoken about. And I know that Agape Youth and whoever else, do a lot of work. RCLs indeed were supposed to be here. RCL formations were indeed supposed to be here. So if we're going to talk, and if we're talking going forward, they have to be part of the conversations that we will have. Thank you.
Thanks very much for those insightful comments, Godwin. If we can then invite Jace. And then if you're still with us, John, it would be great also to have your closing comments before we then hand over to Liko.
Thank you, Chair. There was a question about monitoring and evaluation. So my answer to the question will be government departments or even organizations need to take on the responsibility in terms of putting the mechanisms in place for the monitoring and evaluation process. So that's number one. Number two, that there should be appointing independent evaluators to assess the M&E process. Because, the organization can't really evaluate itself in that sense. So there must be independent evaluators to be able to assess. But number three, which I think is very crucial, is that there must be stakeholder engagement. So the people that you are serving must be given the opportunity to give feedback to say whether you are meeting those targets, whether the policy has been implemented or not. And the last thing that I'd like to point out is that there must be continuous progress reports that tell us exactly whether we are succeeding with those policies and how effective those policies are. And what we tend to do is, when we put in projects, we wait till the end of the project to evaluate it. But I think evaluation and monitoring starts from day one. Thank you, Chair.
Thanks very much, Jace. John, if you're still online, we'd appreciate your closing observations.
Thank you so much, Aaron. I also agree with you, the comments made by Godwin. why they fail is because of failed expectation. They unrealistic expectation. So I think it's very important to clarify expectations right from the beginning, bearing in mind that partnership is not about me helping you and you helping me. But partnership has really got to do with how together can we do what we would not have been able to do separately. And I think that is the basis for collaboration, both within a sector and across sectors. Finally, the only other comment that I want to make is thank you for the affirmation about learner agency and parent agency that you mentioned, Chair. I think that the opposite to me of agency is alienation. And I think that we must guard against alienation from between parents and the education system and learners from the education system. And I think that when you become alienated from your society, from your community, you become alienated from the authorities, you become alienated from yourself. At that point, you burn on Friday what you need on Monday. And I think that alienation is something that needs to be addressed and addressed quite soon. But last comment is, I love the RCLs, I also love the SUVs. And between the RCLs and the SUVs, I think those are the cornerstones of our democracy. We must support. Thank you.
Thanks very much, John. As we head towards Liko and the team, I want to encourage colleagues again online to connect the link to the link for the evaluation, for the council guidance and advice. And for colleagues in the room, we will flight a QR code for you to assist us with the evaluation. And then another message from Robin online reminding us partnership is about co-creation, not outsourcing. I should probably say in capital letters, it's about co-creation, not about outsourcing. So over to you, Liko.
Okay, thank you very much, Chair. There were quite a lot of things that were mentioned, but in the interest of time, I'm not going to respond to everything. Just the key salient issues. The first issue for us, maybe let me start where Veronique left off, where she said that the issues that have been tackled today have been tackled innocently and the criticism has been received with humility, and that is true. Where we have been weakest in CSTL has been in parental involvement. That is true. In fact, I think the entire quantum of social cohesion and social mobilization agenda, we've been weakest there. And I think Ntate Matigan is correct to say that probably because even in the beginning, and I think Sizwe has also mentioned it, that parents have not been involved because they were not sure what their role and expectation and responsibility is. And the call from the online platform that says that, slow down, let's go back and fetch our people so that we can all take off together. Maybe that is true. Maybe we've moved too far ahead that we do need to roll back a little bit and go back and fetch the people that we need, particularly parents, so that we can all, travel together on the next journey. The other thing that you've mentioned, Chair, is that we probably will need to counsel the next administration. What happens with change of administrations in South Africa is that every year, every administration, at least the first 2 years, is about negotiating for space, for care and support. Because each one of them, when they come in, even if it's the repeat, it's almost like we haven't been together on this journey. We almost have to reiterate and reaffirm our position and why we need to do this. And Yes, Dr. Kosa is speaking about hierarchy of priorities. We can make that hierarchy of priorities with JACEs and them, the scientists and the custodians of the domain of education. But there's another layer that we cannot move without, and that is the political ratification layer. Because each administration comes with its own priorities. So even if you say that, hey, we were busy here dealing with discrimination, if they come and they say, I didn't get discrimination, can we deal with toilets? Even if you had started that journey with your stakeholders, that's what you have to now go and manage with your stakeholders. That, hey, Nina, it's discrimination, maime, we are moving to toilets again. That kind of a thing. And so these are the things that we need to be mindful of as we move into the future. I think building the capacity of those that are responsible, I think it was included in the presentation nonetheless. And on the partner story, and this is where, so I used to think that Dr. Kosa is a snob until I had to experience it myself. He always looks at the amount of money that is being brought in and the number of schools that are being impacted. We do have a lot of partners, but then partners come and they say, we want to work in 5 schools. Now you want to pitch that at a national level with a national department for 5 schools, for 2 million. That's nothing. And that's why we keep on encouraging our partners, and it links with the point that was made on the platform again that says that we need to build the capacity of parents and SGBs and schools to build their own collaborations at that level. Because 5 schools is supposed to be local. It's not supposed to be a national agenda. It's 5 schools with 2 million rands. 2 million we spend in a day here. So that's why I think we need to be very careful about the scale is very important. Yes, and then the last thing from me would really be to say that we do need to look at the data story. I mentioned it in my presentation, and it comes again, and it says, is the data that you can use for research, monitoring, and evaluation? And probably what you'll need to do in the next very near future is to ensure that all the pillar leads at DBE, for all of those pillars, need not say that, I can support, that's Granville Whittle's story, because they exist in those pillars. So we think that we'll need to engage more of those pillar leads so that they understand their contribution into the broader narrative of learner and teacher well-being. So if you are in curriculum support, your contribution. If you are in infrastructure, water and sanitation, your responsibility. If you are in material support and LTSM, your contribution. Each one of us need to understand that we've got a slice. Our role as care and support branch is to really just coordinate everybody, but everybody has a contribution to make in the broader narrative of CSTL. Thanks. You want to add?
Andile, take the mic.
So I think for me, quickly, the issue around parenting and parental involvement, I think is a dialogue on its own. We really need to do that. I think we've tried to do that for parental involvement in reading. We know issues around teen pregnancy and that those parents have not been parented in the way that we want them to parent their children. So I think for that one, there's a whole lot of the engagement that needs to be done in that area. Secondly, there was a question, what makes us front runners as South Africa, and I thought that we'll do. I think it's in the work that we have shared in the SADC environment. It's in the framework that we have developed and we are revising. It's in how we have taken the youth agency and the boys vulnerability frameworks, and we try to make sure that as we are updating the South African framework, that is included. It's in the work that we have been doing with the research institutions and how that has influenced the work that is happening in the SADC areas. It's in the fact that South Africa is one of the few countries that has a special issues journal on CSTL and that has thought leadership. So we can actually bring in a number of examples without blowing South Africa's horn. I like the question that you raised, but I think that that's a family meeting between National Department and and provincial department, because my immediate question is, what is the role of the province and what is the role of national? But I think that is a family meeting that you guys can have and fight it on. The last point that I wanted to raise, I think, has been this issue around how do we manage what a partnership looks like. But again, that's a whole lot of debate around whether partnership is about bringing the money or technical expertise or balancing both, or how do you frame that around making sure that those are efficient, those are conducive, but also those bring about impact in the schooling. 1 minute, is that done?
Thank you, Chair.
Thanks very much. Lynn, are there any closing observations from your side as the co-author?
Thank you, Chair. Yeah, I think I don't want to burst Liko and Andile's bubble about South Africa being the forerunner. I think South Africa is the forerunner in many areas, but I think the value of the regional sharing is that South Africa can learn a whole lot from the other countries. So I just want to give one example, and it got raised, I think somebody raised it as a question or a weakness, is the kind of coordination at a national level between sectors. I think Jace touched on this a lot. In some of the other member states, you will see CSTL task teams at a national level that comprise, led by the Ministry of Education, but includes health, other government departments, the UN agencies, labor, so, and they meet monthly, and they're operational, and they ensure integration and collaboration. And I think that's an example that South Africa could actually learn from. Just maybe a bit of information, if people are interested in accessing the CSTL policy framework, as well as the two accompanying frameworks. One is on Child and Youth Agency, the other one is on boys and young men's vulnerability. Both frameworks have been adopted by the education ministers, including our education minister. You can go onto the SADC website and you can find those frameworks. They provide useful guidelines for the priority issues. And then I just would like to end with saying, I've been on the CSTL journey from the beginning, and I'd like to actually thank the NECT and especially Godwin for recognizing the value of bringing CSTL to the fore again by establishing the CSTL investment portfolio that has worked very closely with the DBE and key partners like UNICEF and MIT Africa in terms of maybe highlighting or spotlighting the importance of CSTL again. And it's kind of rejuvenated the movement. And so, this dialogue is just one of many of the events and activities over the last few years that have generated real interest again, as well as the participation from all these different partners who are really keen to work with the DBE, to work within this framework. So I think we're in a good place for, yes, we've made, I think, real progress, but I think we're well positioned now to take it to another level. So thanks, Chair.
Thanks very much, Lynn, for those very helpful and insightful observations. I just want to again remind colleagues, please, we noticed that only 4 of the 112 colleagues online have completed the evaluation. And then also in the room, if we could do so. Dr. Gushiman, if you are still online, it would be great to hear your final observations before we draw the meeting to a close.
Thank you, Chair, for this opportunity. I think I really enjoyed the discussions. It's very, very interesting. The point is well made, I country takes ownership is very decisive. There must be the capacity to take on this implementation in an integrated and multi-sectoral way, depending on the context. And a job that involves such an approach is not a simple matter. That is true. I think it's require a firm commitment and the right attitude and good governance. So we as SADC, we continue to support all partners, all member states, as far as possible to make CSTL not only possible but effective and therefore real. And it is really bad with shortcomings that need to be improved in the field. Thank you so much, sir.
Thank you very much for your input at the beginning and for staying with us throughout the conversation. This is greatly appreciated. Before I hand over then to Duncan to reflect on the way forward, I was struck by Professor Jace Pilley's reminder, maybe stinging reminder, he didn't intend it that way, that we need to be modest when we celebrate our matriculation results. Because the fact is that close to 40%, if not more, of our learners do not make it. And the reasons are varied, mostly to do with vulnerabilities that they experienced. And so I sign off with that strong message about we need a community of care and support to be in the community. And we need to reach a point where care and support is everyone's business. So Duncan, over to you. And please, you can close out the session.
Thank you very much,
well.
Chair, and I really want to appreciate also the inputs that have been made by everyone today. Just a little, perhaps, word of advice to Liko. When that new minister comes and says, no, I'm not doing CSTL, I want to do toilets, there's a very nice TV program called Yes Minister, where the response is, yes, Minister, you're incredibly right to identify toilets as a priority. And of course, they're very much part of CSTL, don't forget that. And perhaps, Minister, on public platforms, if you want to talk about CSTL rather than toilets, it's going to make you sound a lot cleverer, So you know the way to go. In the end, the answer is yes, but you keep the track that you're going on, and that's the important one. Chair, the indications are that we do need more discussion on this. I think this particular dialogue certainly has increased the sphere of influence in many ways. Certainly I have a better understanding of what CSTL is and why it's important, and obviously we need to try and build on that. I think it's an obligation, CEO, that the NECT should try and work on that 500-word abstract in some way. As perhaps civil society handover report, etc. And it might be that once we've got something on paper, we might want to reconvene, particularly this interest group, and see whether we've captured that discussion based on the inputs and presentations of today. So we're committed to doing that. We'll certainly bring in, I think, much stronger the teachers and youth that Godwin has spoken about, and see whether we can conclude it in that way. Thank you very much, Chair.
All right, is there enough? Thanks very much, Duncan. So I think I just want to end off by again extending a warm word of appreciation to all colleagues in the room, colleagues online. I know some colleagues have dropped off online, but thank you so much. It's Friday morning into Friday afternoon. Thank you so much for setting aside time for this very important conversation, this very important reflection on where we've come from, where we are, what the gaps are, what are the exciting initiatives that we have put in place, and what are the areas where we really need to pull our socks up, bobby socks, all kinds of socks. We really have to up our game, and we have isolated a number of these, both exciting, promising, and on the other hand, gaps that we need to close. And I just want to really again say thank you so much to our team who have put together the presentation. I hope that you enjoyed the presentation as much as I did, provided extraordinary insights into where we are, where we need to go, and connected us in very clear manners to the SADC protocol in this regard, pointed us to the 10-part framework that acts as an organizing tool for us. But I'm sure that the slides that we have seen today would be welcome additions to our files as we continue to swell the river of consciousness on CSTL. And let's not, as I say, forget about the good practice, and higher health comes to mind as a very interesting collaboration between state and an NGO on how to press forward and to, as I say, swell the river on CSTL in the case of colleges and universities. I want to sign off then by extending a sincere appreciation to Ntongoloze and the team for putting this together. We had an excellent turnout online. We had a fair turnout in the room. I'm not sure if it's got to do with Friday or the weather in Pretoria, or some folk just couldn't find where we had decided to hide ourselves here in Pretoria, Tshwane. But nonetheless, we are most grateful for all of the work that you've done in the background, and we look forward to you going from strength to strength as we head towards our next dialogue, on which we will give you information pretty soon. So keep an eye out for the next dialogue. And so thanks very much, colleagues. This is greatly appreciated. Thanks, Godwin, for providing oversight, stewardship of this, Duncan, for making it happen. We are most grateful. So take care and have a wonderful afternoon. And if the weekend begins now, have a great weekend. And please, those in the room, you can join us for lunch. Thanks very much.